Hi there, my name is Dr. Matt Rabinowitz. I'm a urology resident here at the University of Pennsylvania, and I am an Inspira Advantage counselor for applicants to medical school as well as to residency. I went to undergrad at the University of Michigan, where I graduated with highest distinction and became a member of Phi Beta Kappa as a junior. I attended medical school at the Johns Hopkins University School of Medicine in Baltimore and matched into residency in urology. While I was a medical student, I served as a student member of the admissions committee and got to understand the process of medical school admissions and learn some more. I am currently undecided on if I will be specializing further with a fellowship or going straight into general urology, but certainly see mentorship and academics as a central part of my future and something that I'm very passionate about. While I was an undergrad at the University of Michigan, I graduated as a 7-term Angel Scholar, meaning that for 7 straight semesters, I had all straight A marks. I graduated with highest distinction and became a member of Phi Beta Kappa as a junior, which is an honor reserved for about 10 to 20 students in each graduating class. I was also a member of Phi Kappa Phi, another honor society in the region, and graduated with a 4.0 GPA. While I was at the Johns Hopkins University School of Medicine, I was a 2-year Lester Persky urologic scholar and graduated as the principal investigator on a grant investigating the impact of sexual dysfunction in patients taking SSRIs, as well as medication non-adherence. I think organization is certainly something that comes to mind, and kind of in the background of that is effective mentorship and leadership and understanding from those who have been successful before what was required, what the expectations are, and kind of understanding that hidden curriculum of things that aren't what meets the eye and how to get the most out of all classes, knowing what resources were most effective in hindsight, and all of those things can only really be accomplished through picking the brain of someone who's been there before, and it's something that enabled all of my success. I'm in the camp that I think there's 100 right ways to apply to medical school and to apply to residency. But what I kind of bring to my advisees is that I've kind of seen how the sausage is made as serving on the admissions committee at Johns Hopkins and now being part of the residency selection committee in my own program. I have the insights into what really creates a strong applicant and what kind of molds it together, what will set you apart from the rest. And those are all things that really just are about presentation, organization, and being proactive in the months, years before you're applying. And those are all things that I try to express to my mentees. I think something that I try to bring to the table with all of my advisees is that I want to help guide you to create an application that is genuine and authentic. And I think those concepts are so important through the whole process, because when you get to these interviews and essays, if you're not showing who you are and expressing your passions, your interests, your strengths, your weaknesses, your application will not be as strong as someone who is. And I think being authentic is something that I try to guide all of my advisees to express. Back when I was a college student at the University of Michigan, I felt lost at times, with a wait list of over 2 months to see an academic advisor. I really relied upon the guidance of some of my peers and older students that I looked up to. And I kind of made it my own mission to be able to provide that to mentees myself. And it's not that I didn't have all the tools, it's just I didn't know how to put them together without some help. And I think that is so the story for so many applicants to medical school and to residency. And being able to provide kind of my experience to help others and to make stronger applicants is something that I love doing in my spare time.